Well, Brian actually helped me write this grant while I was in Papua New Guinea this fall, so he gets me back that on the grant. But I'm here to talk to you about improving safety net clinics by adding laboratory services to them. So Heart to Heart's mission is improving global health through initiatives that connect people and resources to a world in need. What that means is we get things donated to us that we donate back out to organizations, and we have volunteers that go places and make an impact in the world. You all may know that we respond to disasters, and we travel all over the world. We're going to Liberia. We sent our first team in last Wednesday. But a lot of people don't know we work in Kansas City. This is our home. And so we feel like it's really important to impact health here. We are Charity Navigator. It's a 4-star charity, and we are accredited by Better Business Bureau. And this is the way we work. The most important thing is to look right to the center of that flower. We always work with a local community partner. We never go in somewhere and say, this is what you need to improve healthcare. We go in and say, what do you need? What can we help you with? We've been working with safety net clinics in Kansas City for more than 20 years, and what we found that a lot of the safety net clinics lack is the laboratory piece. My bet is 95% of the people in this room have health insurance. And when you go to the doctor, and he thinks your cholesterol's a little high, he draws some blood and does it. Well, if you're at a safety net clinic and you don't have the funds even to go to the doctor, and they tell you, you know, we can run that cholesterol for you, that's going to be $35. That's half a day's wages for somebody that's making minimum wage. So laboratory services in the United States is highly regulated. You have to know exactly what you're doing. You have to follow regulations. It's expensive, and it requires competency check evaluations every 6 months. It's really beyond the reach of a lot of safety net clinics to do it and do it right. So what Heart to Heart has done is mobilize laboratory volunteers through laboratory professional organizations to help safety net clinics set up these labs. So we not only provide all the equipment, we provide the resources and the reagents, we provide technical experts that go in and, number one, teach them how to do the laboratory testing. They answer questions on the phone. They go back every month to check quality control. They go in every 6 months to check competency so that we know those laboratory results are being done exactly right. Right now, we run laboratories in 4 safety net clinics in and around Kansas City. One of them is JDOC, which is a laboratory or a clinic run by the KU residents. They see about 75 patients a week, and we actually started there. We had set up a laboratory to respond to disaster. So we got all ready, and we were waiting for a disaster, which is like really bad karma. So we decided to find somebody to work with, and we picked JDOC in 2008. JDOC at that time said the laboratory was their second biggest cost. And the worst part of it wasn't just the cost. It was the fact that they would draw blood from a patient tonight, they would send it off to a laboratory, and 3 days later get the results back, and then they're trying to find that patient. And quite often with safety net clinics, you can't find that patient. There were times they got positive HIV results and they could never reach that patient again. So those have catastrophic results. We also work with Sojourner Clinic. Sojourner is a lot like JDOC, only it's the UMKC medical students that run a clinic at 9th and Grand, really seeing the indigent patients of Kansas City. We work with Joplin Community Clinic. Joplin went from seeing about 7,000 patients a year to seeing 12,000 patients a year right after the tornado. Think about it. So many people lost their jobs, so they lost their health insurance. The doctor's buildings were gone. The hospital was gone. And so they started seeing 12,000 patients a year. And I have a story to tell you about what Joplin managed to do with their lab after we helped them open it. And just recently, in April, we opened up a laboratory at Heartland Community Health Clinic in Lawrence. Last year, we put in almost 2,000 volunteer hours. Those are laboratorians volunteering their time, and performed over 16,000 tests. So Life with the Affordable Care Act, I've had so many donors say, hey, it's going to take care of everything. We don't need to donate to safety net clinics anymore. The bottom line is the estimates run, depending on the state you're in and the city you're in, that 15 to 30% of the population still is not going to have health insurance or have inadequate health insurance. So there's still that large portion of the population that needs this help. So I want you to imagine what your life would be like without health insurance. Imagine being pregnant. They're supposed to have lab tests done every month, and the last month of the pregnancy, every single week. If you're diabetic, you're supposed to have your glucose done all the time. You're supposed to have hemoglobin A1Cs done every 3 months. You have no money, you can hardly afford your medication, or maybe you can't. You certainly can't afford the laboratory testing to be able to be sure it's treated properly. So I want to tell you the story about what happened with Joplin. Joplin, as I told you, went to 12,000 patients first year after the tornado. For those of you that don't know, hemoglobin A1C tells you basically what your average glucose is over the last 90 days. That's really important because I don't know about you guys, but my husband's a type 2 diabetic. In the last 5 days before he sees his doctors, he is so darn careful about what he eats. So if he went in and had his glucose done, they'd say, "Great job, you're doing wonderful." But if they're doing an average of the last 90 days, the doctor knows exactly what's going on with that patient. Now, what's that important to you and I? What's really important is if a diabetic keeps themselves under control, they don't have all that sequela that comes later. You don't see them losing eyesight. You don't see them losing toes and losing legs. It is saving money to the healthcare system for us to keep diabetics under control that don't have health insurance, because otherwise they show up at the emergency room. Now, I was talking to the manager at Heartland Community Clinic, and he said, "Yeah, I do a great job, and with your laboratory I'm going to do a better job. But the problem is, the CEO of Lawrence Memorial Hospital does not write me a check for the amount of money I save him. I still have to fund the laboratory piece." So at Joplin, we put in their laboratory, and before they had a lab, their patients would get a prescription, just like you guys probably do, and they would have to go 5 miles across town to get a test. No big deal to those of us that have cars. It's hard if you don't have a car. There's not good transportation down there. And then when you get there, you got to pay anywhere between $25 and $50 for that test, and you're making minimum wage. So most of the patients didn't go to get that test done. After the laboratory was put in place, if a diabetic patient comes to Joplin, or when they come to Joplin, the first thing they do is draw that laboratory test, and it's done in 10 minutes. So the patient sits down, he waits, and he goes in with those results to the physician or the provider. And they sit down with him and go, "You know, you haven't really been paying attention. Have you exercised this month? Because your glucose has gone up. And if it doesn't come back down, you're going to start having complications. So I want you to do this. And let's talk to the nutritionist. And I want you to enroll in this class. Here, it's free, but come to the class." And what they did is within 18 months, they had, before the lab, less than 60% compliance. After 18 months, they had more than 78% of their patients within compliance. They changed patient behavior, and I can tell you how hard that is to do. That's not just doing the test. It's really influencing the way the patients behave, and they could do it because they had those results immediately. JDoc does another amazing thing. They offer prenatal services. So you're pregnant. Okay, you guys can't imagine. Your wife's pregnant. You don't have health insurance. How do you pay for all that prenatal work and that labor and delivery? At JDoc, if you go to their prenatal clinic, which happens twice a month, and you can make appointments, and you see them every single month at absolutely no cost, all your lab tests get done free. Then when you go to KU, there's no cost for labor and delivery. And again, that's so important for the baby. It's so important for the mother. It's so important for the healthcare costs in Kansas City. Because those women that don't get the right prenatal, they end up delivering early, their babies are underweight. Long term, it costs the healthcare system.
About running out of time.
Oh, I'm sorry, I gotta talk faster. Okay, so our goal is to open 4 new clinic labs this year. We're gonna be working with laboratory professional organizations, and we're seeking grants to do it. These are the tests that we do. The lipid profile is really important when you start talking about childhood obesity. And these are all the things we provide. The clinic provides a CLIA license, the medical director, the space, the staff, and that's how we do it. Questions?
Do you have a sense of the location of the clinics?
We do not do a central location. What's really important is to be in each clinic.
I'm sorry, no, where are the clinics that you're
Which
planning to
clinics?
work with?
Okay,
Yeah.
so JDoc Clinic is very close to KU. It's at Southwest Boulevard and Rainbow. The Sojourner is at 9th and Grand.
But these are new clinics.
These are new clinics.
Where
I
are
have
they?
3 clinics that are possibilities, and if we get this grant, we'll go back to them and say, who's ready? Riverview is one of them. They're a diabetic clinic. Second one is Turner House. They were here tonight. The third one is Southwest Boulevard Clinic. Those are the 3 that we've been talking to actively. Other questions?
Thank you very much.
Thank you.